Welcome back. You're still watching the Medicine Box, Health Matters, and we're discussing mental health today. We have with us three experts, and I'm going to move over to Dr. Seeba for some questions. Dr. Seeba, well, you do practice out of Chicago, but you are very focused in terms of your work when it comes to children and mental health. So give us a sense in terms of the current problems on a generalized basis that you are seeing within children when it comes to mental health issues.
Absolutely. First of all, thank you for the opportunity to be here today. I think the children and adolescents today are facing a very new world, one which we're all unfamiliar with. It's a world post-pandemic where many of them have spent a lot of their formative years in isolation and social distancing without the ability to form social connections. And then on top of that, they're navigating a world which is largely mediated through screens. So there's a lot of kind of input and kind of sensory overload in terms of social media and the ways they're navigating relationships. So I think that this confluence of different factors is contributing to a rise in depression, anxiety, suicidality, eating disorders, OCD, and that's not just in Chicago. It's global. So the pandemic affected everyone globally. The kind of overuse of media is a global phenomena, and I think it's hitting our young people very hard.
Okay, well, I just wanted to narrow down on the sensory overload on social media and the overconsumption that we're seeing at this point in time. How detrimental, Dr. Seeba, is social media on children?
I think that's a nuanced question, and I think we don't really know the answer. Social media is relatively new, and I think our adolescents are, one of the first generations that's grown up with kind of the constant presence of kind of digital media and internet in their homes. So, at this point, it's part of their kind of day-to-day life, and I don't think they know a life without it. But what we do know is that kind of social media has displaced a lot of regular physiological activities. It's disrupted sleep. So there's a lot of sleep disturbance that's attributed to overuse of social media late into the night. It's displaced for a lot of people in-person interactions, maybe familial relationships. Sometimes they'll see they're on social media. And then also there's this exposure of potential bullying from across the globe. You don't know, it's not just limited to your own school or your own community, but it's a global community. And also social media goes viral. So, you're not just restricted to a certain point in time or a certain geographic location. So I think that there are a lot of potential harms associated with overexposure to social media. On the other hand, I think that there's a lot of access to community members for those who are feeling marginalized or who don't feel like they have people to talk to in person. They are able to reach out and find support for in ways that are not necessarily accessible in person. So I think that it's a mixed bag, but we definitely know that there are some harms associated with overuse of social media at this point.
Okay. Well, just to narrow down on that point on Dr. Seeba, because you said that, social media is a new normal. The apps that we use on a daily basis is a new normal, not only for children, but for adults. So in that context, how does one temper themselves when it comes to social media, become more resilient to issues such as bullying, trolling, body image issues?
That is a huge question. I wish I had a straightforward answer for you. I do know that there are several organizations who have issued plans as to how to mitigate the harmful effects of media. The American Academy of Child and Adolescent Psychiatry, the American Academy of Pediatrics are the ones I'm most familiar with, and they have issued family media plans to sit and talk to your children about how to go about utilizing social media in a way that's safe, or safer at least. And also, there's a lot of modeling that happens from parents, from teachers, from other adults in a young person's world. So if a child is seeking advice, support, or guidance from their parent, and their parent is on the phone, sometimes that's a way of modeling that this is the way you go about getting answers to things. So I think that parents can also have a really effective role in how to model appropriate internet use, kind of limiting the ways that they post or what they post, or talking to their children about what's having their consent about what they might want to post about their children. This is becoming a new kind of policy or a new kind of health promotion tactic as well, kind of discussing posting and social media use and creating a family media plan.
Okay. Well, children also face issues when they go to school when it comes to issues such as bullying. Dr. Seeba, what are the signs that one needs to notice in their children to be aware of when it comes to mental health? And what are the coping strategies that you would recommend as well?
This is a great question. We're having a meeting called Supporting Our Youth, New Directions and Wellbeing with a lot of collaborators here in India and Bangladesh. And what we found is it's very hard sometimes for parents and teachers to identify what's normal in their adolescence versus what's potentially a sign of a mental health related concern. Because a lot of times parents think, oh, it's just puberty, oh, this is adolescence, they're just kind of mouthing off or what have you. But when you're starting to notice that there is some decline in regular day to day function, if there's suddenly a child who was very outgoing and motivated and social or very motivated in terms of academics, suddenly seems like they don't care, they're talking back more, they're less interested in socializing, they're spending a lot of time sleeping or in their room or having difficulty sleeping. So anytime you see a change from baseline or a change in the norm, that's when you start to notice, is something happening with my child that is that's affecting their way of kind of day-to-day functioning. And when you see signs of impairment, that's when you start to become concerned.
Okay, all right. Dr. Shah, I'm going to come to you on this. We did discuss, and Dr. Parikh did mention that it is very important to have social interactions and a network. How important is that network of family as well as your entire social circle when it comes to mental health, coping with mental health?
It's extremely important because that is the first point of contact, right? So when somebody is in emotional distress, the first person they will turn to is someone that they love or someone they trust, and that trust is a very important factor to be able to confide in someone. So having a network of people will make you feel like you have someone around you that you can talk to, that you can reach out to before going to somebody who is completely unknown to you, professional. So that network is your first point, immediate contact, and that's very, very important.
Okay, but is that recommended?
Absolutely. I think everybody, we humans are social animals. We are used to a lot of human interaction, and that interpersonal interaction is so, so important to keep us to make us feel secure, to make us feel loved. It's an innate requirement to feel like we have people around us who care for us, who feel for us. So everybody should have and should continue to work towards keeping that network around them.
Dr. Parikh, before we wrap this up, just wanted your sense in terms of a couple of strategies, because a lot of people talk about how meditation can help mental health, positive thinking can help mental health, think about the now, don't think about the future and the past. There are various strategies which people can adopt, take up a hobby as well. Are these all feasible solutions when you do suffer from mental health issues? And what would be the most feasible solution according to you, or strategies to cope?
They're good for everyone, right? Let's just rephrase your question and assume that you were talking to a cardiologist. What would you have said? You would have said the same thing the cardiologist would have answered. Yes, but with the medications, or yes, but with the stent or surgery or whatever it is. Good lifestyle will always have a positive impact. No question around that, irrespective. You don't need to have an illness to have the benefits of a good lifestyle. But if you have an illness, taking treatment of the illness will not be substituted by anything else. And evidence-based treatments have to be ensured that they reach the last mile, but within the quickest framework of time that is possible. That's why when we talk about strategies need to be individual, which means what I do for myself. Social, which is what all of us as a collective do for each other, loved ones. Workplace, school, policy, social media platforms, so on and so forth. All of us have a role to play. Mental health means each individual is a stakeholder. And when all stakeholders put in their effort together, for probably the next 3 to 5 decades, we will find a solution to mental health which will reach everyone
Okay, all right, Dr. Parikh, Dr. Seeba, as well as Dr. Shah, it's been a pleasure, and I think this is only part one of discussing mental health issues. I think we've just about scratched the surface, and we have a long way to go when it comes to, going deeper when it comes to this particular topic. Thanks very much for joining in and speaking to us.
Thank you.